How does the Tay-Sachs heterozygote advantage theory work? Have you ever wondered why certain genetic conditions persist in specific populations? One fascinating example is Tay-Sachs disease and the theory surrounding the heterozygote advantage. This theory suggests that people who carry one copy of the Tay-Sachs gene mutation might have had some benefits that helped keep this mutation alive in certain groups, especially among Ashkenazi Jews. To understand this, we need to look at what happens with gene mutations. When someone has two copies of the Tay-Sachs mutation, they develop the disease. However, those with just one copy, known as heterozygotes, do not experience the disease. This raises the question, what advantage might these carriers have had in the past that allowed the mutation to persist? One idea is that carriers could have been more resistant to tuberculosis, a serious disease that affected many people in the past. However, studies have shown no significant difference in tuberculosis death rates between carriers and non-carriers. So, this theory seems less likely. Another possibility is that carriers of the Tay-Sachs mutation might have had some cognitive benefits. Some researchers believe that having a single copy of the mutation could enhance brain function or intelligence. This could have been particularly useful in historical contexts where Ashkenazi Jews often held intellectual jobs. Additionally, the high frequency of the Tay-Sachs mutation might also be explained by genetic drift and founder effects. This means that a small group with a higher mutation rate grew, spreading the mutation throughout the population without necessarily providing a survival advantage. From a biochemical standpoint, carriers of the Tay-Sachs mutation have about half the normal activity of an enzyme called hexosaminidase. This enzyme helps break down certain fats in the brain. While having one copy of the mutation does not lead to disease symptoms, it may have subtle effects that contributed to the proposed advantages. Understanding the heterozygote advantage theory is important in family genetic testing and hereditary health. It helps explain why Tay-Sachs mutations remain as common in some populations, despite the severe effects of the disease in those with two copies. This knowledge also highlights the significance of carrier screening in groups with higher mutation frequencies. It can guide reproductive choices and help manage hereditary health risks effectively.